Hi friends, it's a routine case, 62-year-old male with IOL power of 19 diopter. We have planned stop and chop in this case. To start with, first we'll pour visco over the cornea to make the cornea clear and bright. Now it's time to make the entry. As I always tell, always make a 2.8 mm incision at posterior limbal site. You can see in this case, as we made the incision, there is slight bleeding. This bleeding helps to heal the incision faster. Air is injected to stain the anterior capsule. Now we will be using Trypan blue below the ear. We spread the Trypan blue in all the directions. Now I used phenocaine. It makes the surgery very comfortable. There is no stretching of iris for the patient and they feel comfortable during the surgery also, what I have observed in my surgeries these days. You also get a full pupillary dilatation with the use of phenocaine-like substance. You can use of any other company now. There are a lot of other companies coming with the same combination of lidocaine, phenylephrine and tropicamide. Aiming to have a rhexis of at least 4.5 to 5.5 mm. It makes the surgery easy. During phaco, during cortical aspiration, IOL implant, every way. Now a side port is made 4 clock hours away from the main port. Few people are comfortable 3 o'clock hours away, but I am comfortable at 4 o'clock hours away. Now it's time to do hydro. You can see the wave of fluid going from one side to other. In between you have to decompress the capsular bag. Multi-quadrant hydro can be done. It will give both hydrodissection and hydrodelineation. A good hydro at this stage makes surgery easy because you can easily rotate the nucleus. The cortical aspiration is easy. Epinucleus can be removed easily. Visco injection. Now it's time to rotate the nucleus. You can see with the dialer, I am rotating the nucleus. It's in slow motion. You can see the full movement of the nucleus. I do it each and every case. Some extra time gives you a lot of comfort during surgery, especially in later stages. Now it's time to start with Phaco 1. Stop and chop we are using. Always enter into the eye with irrigation on. I made the eye stable with one of my dialer or chopper from one side. Then I enter from the other side as a counter force. Epinucleus above the nucleus is eaten away. Now it's time to form the tunnel. At least 80 to 90% depth of the nucleus. Phaco parameters here are the power is 60, vacuum is 40 and flow rate is 25. We don't need too much vacuum in Phaco 1. Small air bubble hindering the view, so I aspirated it. Now the tunnel is complete almost. Now it's time to divide the nucleus into two parts. Now you can see a red glow once the partition is complete. As you can see, the red glow is visible. Now we have two D segments of the nucleus. Shifting into Phaco 2 with a vacuum of 380, power 60 and flow rate of 40. Dividing this segment into two parts with a vertical chop, taking out the segment in center of the anterior chamber, where we have maximum space to apply the phaco energy so that there is no damage for the corneal endothelium and we are also away from the PC. We hold the segment, bring them little bit towards the center, divide them into the two pieces and then we take the piece into the center and emulsify it and aspirate it. Now the other D segment made in front of the phaco probe. Same, we hold it, pull it little bit towards the center and vertical chopped and then emulsified and aspirated. In between, my assistants keep on pouring the BSS over the section so that there is no wound damage. Especially in hard cataract, I tell them to put saline or BSS over the wound regularly. Now I am in Phaco 3 trying to aspirate the epinucleus. Here the vacuum is hardly 250, flow rate is 25 and power is 25. You don't need too much power in Phaco 3, but personally I felt that I can aspirate this epinuclear and cortical material with my coaxial IA. The benefit of coaxial IA is this, that you can have high vacuum. The opening is little bit bigger, so you can even aspirate the epinuclear part and cortex very fast. Here in IA1, the vacuum is 400. I go up to 450 also. As you can see, I hold the cortex, bring it to the center and then aspirate. Trying to pull the cortex from all the quadrants and bringing towards the center. In subincisional valve, you have to be little bit cautious. The whole chunk of the cortex came out. Little bit of this is calcified, so taking some time. Full vacuum was applied and aspirated. Now you can shift to IA2 where vacuum is hardly 100. As you can see, there is a small cortical fiber. I aspirate it in IA2. Decreasing the vacuum in IA2 helps to aspirate any cortical fibers, and you will not hold the posterior capsule also, so that will make the surgery safe. Now the visco is injected. It's time to inject the lens. The patient was planned for Hoya 250. It's a preloaded lens. A spheric one. The lens is injected. Now both the haptics are in the bag. It's time to do the visco wash. With coaxial, always on, enter into the eye. If you enter without irrigation, there will be a large air bubble that you have to aspirate first, then you have to start. So always enter with irrigation on, washing the visco above the IOL and also in the angles. Now we are going behind the IOL, as you can see, lifting the edge and just aspirating behind the IOL. Behind the IOL, visco wash is very helpful to make the eye quiet next day. The pressures will be normal. And if you are doing some toric IOLs, then especially it's very important to wash the visco behind the IOL. Many surgeons in their beginning days can wash the visco behind the IOL by just tapping over the IOL repeatedly so that the visco comes in front and you can wash. But you have to learn washing the visco behind the IOL also, whether you are using bimanual or coaxial, by both. Now it's time to form the chamber. Just a small wash of the anterior chamber with BSS, hydrating both the sides of the main wound. Just take care that don't put too much pressure. Always keep an eye over the section so that there will be no DMD. Now it's time to hydrate the side port. Here you can apply a little bit more pressure. It's much safer than the main port. And yes, the case is done successfully. Thank you. Thanks for watching.